this is the Human Resources Department here at Global, and we will be covering our Airborne Infectious Disease Exposure Prevention Plan today. So this is our overview. Our Airborne Infectious Disease Exposure Prevention Plan is there to protect employees against exposure and disease during an airborne infectious disease outbreak. Plan goes into effect when an airborne infectious disease is designated by New York State's Commissioner of Health as a highly contagious communicable disease that presents risk of harm to the public health. The plan is subject to any additional or greater requirements arising from a declaration of state of emergency due to an airborne infectious disease. All employees may report questions or concerns to the designated contacts for our K through 8 and for our high school, including the Fine Arts Center. It would be our building principals, and here at our central office, it would be for our human resources specialists. This plan applies to all employees as defined by the New York State HERO Act. You may refer to the New York State Department of Health and Labor website for information on whether or not the designation has taken effect. Currently, it has not taken effect. So, our responsibilities. This plan applies to all employees of Global Concepts Charter School and at the following working sites. So that would be our K through 8 on Ridge Road, our high school on Johnson Street, our Fine Arts Center on Roland Avenue, and our central office on Abbott Road. The following supervisory employees are designated to enforce compliance with the plan. So here at our central office, it will be our CEO, Tracy McGee, and our HR specialist, Deanna Melly. At our K-8, it would be our principal, Jack Turner, and at our high school, it would be our high school principal, Liz Mastromario. Exposure controls during a designated outbreak. First off, it would be general awareness. That would be maintaining physical distancing, exercise, coughing, and sneezing etiquette, wearing face coverings, gloves, and personal protection equipment, also called PPE, and as appropriate, limit what you touch, stop social etiquette. That would be hugging, handshaking, gathering around in bigger groups, anything like that. And of course, wash hands properly and often. Then we have our stay-at-home policy. If an employee develops symptoms of the infectious disease, the employee should not be in the workplace. Employees are instructed to inform the school nurse and follow New York State Department of Health and CDC guidance regarding isolations and medical care. Third, our health screening. Employees will be screened for symptoms of the infectious disease at the beginning of their shift and are to self-monitor for symptoms throughout their shifts. If new or emerging symptoms and signs should be noted to the nurse, and the employee should be removed from the workplace. Fourth, our face coverings. Face coverings and physical distancing should be used together when possible. Employees will wear face covering throughout the workday as designated at any given time. Fifth, our physical distancing. Physical distancing will be followed as much as feasible and will be determined by current guidelines. Sixth is hygiene, hand hygiene. To prevent the spread of infection, employees should wash hands with soap and water for at least 20 seconds. Seventh, cleaning and disinfection. We will cover that in another section further on. 8 is our respiratory etiquette. Employees should exercise appropriate respiratory etiquette by covering nose and mouth when sneezing, coughing, and yawning. 9, special accommodation for individuals with added risk factors. If you fall under that category, please reach out to our Human Resources Department. Advanced controls during an outbreak. First, we have elimination. Global Concept will consider temporary suspension or elimination of potentially hazardous activities where adequate controls could not provide sufficient protection for employees. That would be limiting or eliminating in-person learning. For example, moving anything online, that would be possible too. Then would be limiting gatherings by location. We could move things outside and anything like that. And third, limiting or eliminating in-person recreational or sporting events. Second, we have engineering controls. Global concepts will consider appropriate controls to contain or remove the infectious agent, prevent the agent from being spread, or isolate the worker from the infectious agent. First, we have mechanical ventilation. Second, we have general ventilation. That would be, for example, air purifiers, anything like that. And third, we have natural ventilation. That could fall under category opening windows, opening doors, having one window open, having a door open on the other side, and having a fan in the middle just to help get the airflow moving. Third, we have administrative controls. Global concepts will consider appropriate policies and work rules to aid in preventing exposure. Fourth, personal protective equipment, also called PPE, devices like eye protection, face shields, respirators, and gloves that protect the wearer from infection. That would be your surgical mask that you could wear or your N95. Exposure control, readiness, maintenance, and storage. First, we have our housekeeping during a designated outbreak, disinfection methods and schedule. Objects that are touched repeatedly by multiple individuals must be cleaned frequently with an appropriate disinfectant. Surfaces that are handled less often or by fewer individuals may require less frequent disinfection. Second, we have our adjustments to normal housekeeping procedures. Normal housekeeping duties and schedules should continue to be followed during an infectious disease outbreak to the extent practicable and appropriate consistency with New York State Department of Health and or CDC guidance in effect at the time. Third, if an employee develops symptoms of the infectious disease at work, it is ideal to isolate the area in accordance with guidance issued by the New York State Department of Health and CDC before cleaning and disinfecting the sick employee's work area. As feasible, liners should be used in trash containers. Please don't overfill your trash containers, and if you are closing the back, don't squeeze out the air so any germs could get onto you. Infection response during a designated outbreak. Instruct the sick individual to wear a face covering and leave the worksite and follow New York State Department of Health and CDC guidance. Inform the school nurse and follow global concepts COVID-19 containment, testing, and contact tracing plan. Follow local and state authority guidance to inform impacted individuals. Training information during a designated outbreak. Global concepts will verbally inform all employees of the existence and location of this plan, the circumstances it can be activated, and the infectious disease standard, employee policies, and employee rights under the HERO Act. When this plan is activated, all personnel will receive training which will cover all elements of this plan and the following topics. First, the infectious agent and the disease it can cause. Second, the signs and symptoms of the disease. Third, how the disease can be spread. Fourth, an explanation of this exposure prevention plan. Fifth, the activation and location at our worksite that may involve exposure to the infectious agent. Sixth, the use and limitation of exposure controls. 7, a review of the standard, including employee rights providing under labor law, section 218B. The training will be provided at no cost to employees and will take place during working hours, appropriate in content and vocabulary to your educational level, literacy, and preferred language, and verbally provided in person or through telephonic, electronic, or other means. Plan evaluations during a designated outbreak. Global Concepts Charter School will review and revise the plan periodically upon activation of the plan and as often as needed to keep up to date with current requirements. Retaliation protections and reporting of any violations. No employer or his or her agent or person acting as or on behalf of a hiring entity or the officer or agent of any entity, business, corporation, partnership, or limited liability company shall discriminate, threaten, retaliate against, or take adverse action against any employee for exercising their rights under this plan, including reporting conduct the employer reasonably believes in good faith violates the plan or airborne infectious disease concerns to their employer, government agencies, or officials, or for refusing to work when an employer reasonably believes in good faith that such work exposes him or her, other workers, or the public to an unreasonable risk of exposure, provided the employee, another employee, or representative has notified the employer verbally or in writing, including electronic communication, of the consistent working conditions and the employer's failure to cure of it. The employer knew or should have known of the inconsistent working conditions. Notification of a violation by an employee may be made verbally or in writing and without limitation to format, including electronic communications. To the extent that communications between the employer and employee regarding a potential risk of exposure are in writing, they shall be maintained by the employer for 2 years after the conclusion of the designation of a high-risk disease from the Commissioner of Health, or 2 years after the conclusion of the Governor's emergency declaration of a high-risk disease.